Hi everybody, I'm Matthew Hammond. I'm the Trustwide Matron for Safer Staffing. I've been asked to do a short video for MHSOP around some of the work that we've been doing around safer staffing over the past year. So first of all, before I start, just kind of wanted to acknowledge the fact that staffing's been incredibly challenging over the past 12 months for all services within the Trust, including MHSOP. And I just wanted to acknowledge really how challenging that's been and how well teams have done to ensure that patients are kept safe and well cared for all the way through. And that in itself is a massive achievement. And just kind of wanted to start by saying that. Some of the work that we've been doing around safer staffing has been very much focused on making sure that the processes are in place for when staffing isn't how we'd like it to be. So we developed something called the red flag staffing events process, which is some really clearly defined kind of staffing events that we'd say are unacceptable and would put patients at risk, and developing a really clear escalation process around that and making sure that that process is in place and able to work. Some of the other work that we've been doing, so we've been doing lots of work around data and pulling data together. And one of the things that we've done is we've developed something called the Safer Staffing Dashboard, which kind of pulls all the different types of information that we look at to be able to say staffing's good, bad, and what the effects of that staffing are on patient quality, patient safety, staff, workforce type stuff, and to pull it all together in one place and make that really accessible for everybody. So all that information, both for the red flag staffing events and the dashboards, are all on Connect under the Safer Staffing page. So if anybody ever wants to look at it, that's where you can find them. One of the really big pieces of work that we've done has been around that budgeted establishments and making sure that they're right within MHSOP. And each of the inpatient services within MHSOP, so each of the wards, the ward managers have done 2 lots of data collection now for something called the Mental Health Optimal Staffing Tool, which is a national tool which NHS England and Improvement expect us to use. And what that does is it allows us to measure patient acuity and be able to translate that patient acuity into a staffing figure for us to be able to say, based on our level of acuity seen within our services, here's what the staffing should be at a minimum. And we've been through that process, so there's been 2 lots of data collection now, which is really helping us understand that a little bit better, and it will help us in future to be able to say, okay, the acuity is changing, so we might need to change the staffing numbers attached to that. And finally, one of the other big pieces of work that we've done is about the community teams, and it's a piece of work that's still in the early stages, but will be going forward within 2022. And it's around community teams having the same sort of staffing infrastructure in terms of the systems and processes as the inpatient services, recognising the fact that it's just as important that we have as good oversight and that those processes are just as robust within the community side as it is within the inpatient. So one of the things that we're going to be doing going forward, and we're just kind of finalising what that's going to look like, is the community establishment reviews. So as all the inpatient services, they all have establishment reviews at least twice a year, if not more if staffing's more of a challenge. The community teams are going to have a similar process, so they'll have a establishment review, and like I said, we're hoping to start rolling that out in 2022. But again, just to finish off to say, again, staffing's been a real challenge, and everybody stepped up to the mark to keep patients safe and to keep that high quality of care. So just a big thank you to everybody, and I look forward to working you all again in 2022.